You know, I've done this, I don't know, 3 or 4 times now over the years, and about, I guess, 4 or 5 years ago, President Obama had just been elected. I don't think the inauguration had occurred yet at that time. We were kind of in that zone, and I was asked to talk about where healthcare was headed, and I gave a pretty honest assessment of where I thought it was headed, and not too many tomatoes hit me, but nobody liked the message. And I had at least a dozen of you came up to me over the next few days and said, boy, that was a real downer. And I said, well, you know, that's kind of what's going on in healthcare, and that's where we're headed, and it's ugly. And a couple years later, I came back and I started out by saying, see, I told you so. And 4 or 5 years ago, you heard very little about healthcare in the news. And I think I told you that we were going to hear a lot about it in the future, and now it's about, seems like it's at least half of the news stories anymore. So today I'm not going to tell you all the things about, you know, our federal government's in trouble financially and healthcare is where they're making the cuts and, you know, all the big picture stuff. I think you've heard that probably enough times. It's in the paper or the media in some way, shape, or form all the time. And I thought I'd talk a little bit more about where the industry's going and what it means to the Tri-Cities. And in the big picture, you know, if you look at the economic healthcare of the Tri-Cities, we're in this little bubble, and it's a great place to be. And we kind of lag behind the rest of the country in what happens economically here. And healthcare is kind of the same way. You can watch what's going on in much of the rest of the world, and it will get here a few years later, and usually watered down a little bit, not as bad as what the rest of the world experienced. Some of the really positive things that have happened in healthcare in the Tri-Cities, we've had a significant increase in the number of specialists, physician specialists in town. It used to be that there was this whole long list of things. You had to go to Spokane, Seattle, Portland, somewhere else to get those services. And all 3 hospitals have healthcare systems in the Tri-Cities have brought in a variety of specialists. And there are many things you can do here now, and a lot less people leave town. And that's great from a patient perspective and a family perspective. There's also been a significant increase in the range of services. You know, we have open heart surgery in town. We have neurosurgery at an expanded level. There are a lot of things at all of the hospitals that we do that weren't done a decade ago, and I think you'll see that continue to develop. So the combination of the two keeps people in town. For the commercial message, as Kadlec has become more regional, you know, we've been able to accommodate more services and more people staying in town. One of the big things that's happening in healthcare is the electronic health record. And I don't know that much about the electronic health record that the other 2 hospitals use, but the one we use is one of the national leading record systems. And most of the big hospitals in the Northwest use it. OHSU has it in Portland. The Providence system has it throughout their system. Group Health uses it in all their locations. It's at Sacred Heart up in Spokane. It's becoming very, very prevalent. And what that means is the day's coming where when you do have to go out of town for your care, if you're at an institution or even a doctor's office that's on that system, they'll be able to see virtually everything that happened to you when you were here. Or if you go there and come back here to your doctor or to the hospital, we'll be able to see what you did over there. And that's a really big deal, not just from a convenience perspective, but it really helps the clinical care. It improves the quality of care. It avoids duplication of services. I don't know if you can appreciate how big a deal that is. But if you think back to banking, where you had to go to your bank to do anything years ago, and now you can go to just about any bank in the country or in the world with the right card and do things. It's that level of that magnitude of difference. Probably the biggest thing I've seen in the last 6 or 7 years is the increase in primary care physicians. A few years ago, if you were new in town, it was really hard to find a physician. And if you were Medicare, it was even worse. Today, we've all recruited a lot of family practice physicians, internal medicine, physician assistants and nurse practitioners. And it's not difficult now to get a primary care physician. And in the future, I think that's going to be a challenge because there are so many of us with gray hair and gray beards that are going to use more and more services down the road. And I think one of our biggest challenges is going to be the manpower for primary care. And one of the other things that's happened in the region that bodes well for the future is we've become, the Tri-Cities has become a center for training healthcare professionals. Trios has a family medicine residency. We're looking at developing one. The university, WSU, I almost said FSU, I'm a Florida State fan, guys, sorry. WSU has expanded their nursing program, CBC's expanded theirs, and there are all kinds of allied health programs. So we have become the community where we train people for the entire region. The Accountable Care Act, without going into too much detail, it's really not health care reform. It's just a reform of how the bills are paid. It's a reform of our insurance system. And that's the reason it's not going to get us where we need to go. It doesn't address all the duplication of services, both the structural duplication and operational duplication. It doesn't get into tort reform. We still have a lot of physicians who order a lot of diagnostic tests, who do a lot of procedures, who do an awful lot of things that cost a lot of money just so that they know they won't get sued and somebody can't say, gee, why did you miss that? We have to have tort reform, and it has to occur nationally. And I'm not very optimistic. Washington, the state of Washington, will probably be one of the last places to have tort reform. And if I understand it correctly, tort reform is a state issue, not a national issue, and it's like a non-starter. So that's a major problem before we get to where we need to go. One of the other things that we as a society haven't figured out, Americans don't understand that someday they're going to die. I mean, you guys just don't think you're going to die. You think we should keep you alive forever, and the doc ought to be able to fix anything. My father was a classic example. He thought there should be a surgery or a pill for anything that ever went wrong, and he was going to live forever. And the comparison I'll give you, my father-in-law many years ago had end-stage renal disease and cardiac problems, and everybody knew he was going to die, and it was only a matter of time. And he and the family chose to stay at home, have hospice, and he was in his bed at home with the family there when he died, and that process went on for 2 weeks from the time that the family said no more care until he died. And there are other situations where, with the exact same clinical situation, they end up in the hospital, and we spend $750,000 keeping them alive for an extra month beyond that with the worst possible quality of life. And we have to be, as a society, we're going to have to figure out that we really are going to die. We need to figure out how to do that gracefully. And we need to find a way to have it be a more positive experience. Lying on an ICU bed on a ventilator for a month before you die is not a graceful way to die, folks. And we just can't seem to cope with that. And I'm not about going out and pulling a plug. Don't take me wrong. I don't mean that at all. But we spend a huge amount of Medicare's money on those last few weeks of life. And that's a major problem, and it's significantly different than what most of the rest of the world does. So that's a big part of the dollar issue. The other thing we have to do to make health reform work and to get us where we need to go is to change what we get paid for. Physicians, hospitals, the entire healthcare system gets paid for getting you healthy once you get sick. We have to change the entire paradigm to where we get paid to keep you healthy. I don't know what Mike did to injure his foot up here, but if we'd spent some money keeping him from injuring his foot, we'd probably save some money. So you kind of get the point. We need to figure out how to set up a system that rewards people and organizations for keeping the population healthy, and we don't know how to do that. And we have all these various constituencies, these special interest groups that are doing everything they can to keep that from happening. The physicians and their societies don't want it to happen. The hospitals are part of the problem. If we spend all our time and money getting everybody healthy, we put ourselves out of business. So I don't know how we're going to make that shift, but it has to occur. The other thing is we're still a mom and pop industry. In the Tri-Cities, Kadlec's a pretty good sized organization and a pretty good sized healthy budget. But in the big picture, we're just a small cog in the wheel. And we're not a big hospital if you go look at cities, and there are things we can't do. We don't have the ability, we don't have the skill set to manage population health, to figure out how to keep people healthy, even once the reimbursement changes. It's a whole different way of doing business, and we don't know how to do that. And there's also the insurance business. The federal government is in the process of changing the reimbursement, where they're going to say to hospitals and health systems, we'll give you X amount of dollars to keep this population healthy, and you've got to figure out how to do it. And they're essentially trying to make the healthcare providers into insurance companies. And managing insurance risk and insurance companies is a whole different beast than what we do, number one. Number two, you have to be really big. There's a whole debate going on in healthcare about how big do you have to be able to assume insurance risk and population health management. And the conventional wisdom right now is like $5 billion of business a year before you're big enough to do that. Kadlec is just under $400 million. So we're talking, what is that, 5, 10, 15 times as big as us? It's a really big system that is going to be necessary to do that down the road. So our challenge is, the demand's going to go up as you guys get older and use more services, and there's going to be less money to do that. And the baby boomers are kind of a pain in the butt. You always really expect higher service than any generation before. You expect higher quality, and you don't want to pay for it. And that's my world in a nutshell. The impact it's going to have on the purchasers of healthcare, the businesses and the individuals. If you buy on the exchanges, that's going to be a whole new world. And in a lot of ways, that kind of transparency is a great thing. The problem is that the way I got chastised a couple of years ago for calling the new world Obamacare. And now the whole world calls it that, so I assume I can do that. But regardless of what you call it, the problem with the way it's designed, one of the major problems, you heard about all the people that lost their health insurance around the beginning of this year. Well, what happened is you used to be able to buy health insurance if you went out in the market and bought it yourself. You could buy a fairly inexpensive plan that didn't have great benefits, or you could buy a high deductible. You kind of customize it the way you wanted it. Under Obamacare, any plan that's below a certain minimum level of benefits is not allowed, and that's all those people that got canceled. But there's another twist on that, and that is any plan that is richer than a certain amount of benefits, they call a Kadlec plan. It's not Kadlec, it's Kadlec. And that was their term, not mine. What they've said is if you're an employer with more than 50 employees and you have a plan that's too rich in benefits, you have to pay a penalty, you have to pay a tax. So what they're doing is they're saying you can't have these low benefit plans and you can't have these high benefit plans, and everybody has to be in the middle. Now, I don't know about the rest of you, but that feels like it's headed towards socialized medicine. And I'm not here to promote or talk against socialized medicine. I'm just telling you that feels like that's where they're pushing us. The other problem that I'm really, two things I'm really concerned about in the exchanges in Obamacare. One is that it's predicated, like all insurance, upon a number of healthy young people signing up and not using it. And they're not signing up. They're smart enough to figure out they don't need it and it's not worth what it costs. The other part, the people who are signing up are the elderly that burn up a lot of health care, or people who have chronic conditions who know they're going to spend more than whatever that deductible is, so it's a better deal to sign up. And the last piece is the deductibles on most of those plans are very high. And I don't think the general public's figured that out yet. They go, these I don't know what the number is now, 2, 3, 4 million, whatever the number is signed up for the health insurance exchanges. They're signing up thinking they're getting a heck of a deal. And I don't think most of them realize how high the deductibles are. And different plans have different deductibles, but they're very high compared to what many of us are accustomed to. And I think what you're going to find is people who can barely afford to buy the insurance on the exchange to start with are going to find out over the first 6 months of this year that they have huge deductibles that they can't pay either. And I think you're going to see a backlash from those folks when they figure out how much the deductibles are. You're also going to end up seeing narrow or tiered networks. we're already starting to see insurance companies that come in and say, okay, we want Trios to be the only provider for this network, or Kadlec to be the only one for this one, or Lords to be the only one for this one. You're going to see narrow networks, and patient choice is going to go away. And they're going to tell you where to go. It's going to feel like the old HMOs. You know, for the politicians, the word HMO is a dirty word, and you won't ever hear a politician say the word HMO because the general public got really angry about the way HMOs worked. But it's going to feel like the same thing as we move down the road. There's some really good things coming out of Obamacare. I think it's great that they now cover pre-existing conditions. You know, it used to be if you had cancer and you worked for the lab, you were one of Mike's employees, and you wanted to leave and go to work for Rand, you could get insurance on Rand's health insurance plan, but 9 times out of 10, we wouldn't cover that cancer if that employee came over because it was a pre-existing condition. Now they can't do that. Everybody's covered in pre-existing conditions. They also now cover students up to a higher age and adult children that live at home up to a certain age. All those things are really good, but they all cost money. So I was listening to the news this morning, and I heard about the Accountable Care Act, or the Affordable Care Act, and I had to chuckle because all it's done is drive up premiums. And it's going to keep happening, I'm afraid. From a hospital perspective, I think we're going to see significant consolidation in the industry. We're going to evolve from a mom and pop industry with lots of independent hospitals to some big mega healthcare systems. And I don't know who the players are going to be and who the winners are going to be and who the losers are going to be, but it's clearly happening all over the United States, and it's going faster. Seems like every month you hear about more consolidations as everybody tries to get better, get cost savings, and improve their quality, and frankly increase their market strength. We're going to see a shortage of physicians. I mentioned that before, but if we get far enough ahead of the curve, hopefully we'll be able to produce primary care physicians and primary care nurses so that the Tri-Cities doesn't have the shortage that the rest of the country is going to have. But that's coming. I think you're going to see declining margins in all hospitals. And when you get declining margins, it's going to be harder to keep up your physical plant. We're going to end up with a more, what I call a generic hospital. A lot of the nice things or the fancy things we do are going to go away. So the patient's going to experience higher costs for insurance, higher deductibles, less choice. You know, they're not going to be happy with where the world's going. But we as a society are going to have to figure out how to change, because what we're doing now just doesn't work. So in summary, you know, the Tri-Cities is pretty insulated. It continues to be so. Well, whatever happens in healthcare, I think will take longer to reach us, and it may not impact us as much as some of the rest of the world. You know, we have the national financial crisis that's driving a lot of this. You're going to have reduced access to services, reduced choice, increased insurance cost, more mid-level providers, more physician assistants and nurse practitioners providing primary care. I personally question the viability of the Affordable Care Act, but I think what's really going to happen, it really doesn't matter whether it's the Democrats or the Republicans in the White House or in the Congress. It really doesn't matter who's running Washington, D.C. You know, the economic formula is the same. The economic problem's the same. Too many people aging, using more services, less money to pay for it, and a demanding public that wants higher quality. So, you know, you can blame Obama. I'm not a big Obama fan, but you know, he didn't create the problem, and he probably won't solve it. So the good news is we're in a good place in the Tri-Cities, and you know, we're able to. The healthcare community has 2 other roles that I think are important. Is he getting ready to get the hook? One of those is we need to provide great health care, so when you need to bring businesses to this community, we can show them that we can take care of their people, their families, and so forth to make this an attractive place to live. We need to create a great quality of life for everybody that lives here. And the good news is it's getting better every year, and I think the healthcare system's doing a great job. So thanks for the opportunity to come talk to you today. And Carl, I'm right on schedule, I think.